Nesty-Tonge. Doc, how are you?
I am good, Simone. I am good. It is so good to see you, and thank you so much for having me.
Yes, and all my guests are very special to me and to the program. But our guest this evening is especially special to me because we've
Mhm.
been friends for over 30 years. We're not trying to age ourselves, Gilda,
Yeah, yeah,
but
yeah,
it's
yeah.
been over 30 years of friendship. So
Oh my
it's
God.
truly a
Yeah,
it's
through
truly a
thick.
cherished friendship. So how is Dominica?
Dominica is great. Just to go back to the friendship thing, through thick and thin. I mean, we
Yes.
were in preparatory school together, high school. Were we in prep together? Well, high school for
High
sure,
school.
college,
Hmm.
university,
Hmm.
and somehow we managed to keep in touch, which is really
Yes,
great.
which is
So,
wonderful. And I'm so proud
mhm.
of all the work that you're doing in Dominica and the way that you're raising your family. I mean, you got a household full of boys. So,
I do. I have my army, definitely. I feel very protected.
yes, I can imagine. I
Hmm.
can imagine. So let's get to know our guest a little bit better, and let me go ahead and introduce who she is, and then we can get into a conversation of why she's joining us here this evening. So, Dr. Nesty is a general medical practitioner who has been practicing medicine for many years. She is currently based in primary healthcare and does private office hours at Hillsborough Medical Center on the weekends. She graduated with her Bachelor of Science degree in chemistry from Midwestern State University in, we won't say the year, that's not needed. She continued on and graduated with a master's degree in biology from the University of North Texas. She started medical school attending Ross University School of Medicine. Upon graduating, Upon graduating from medical school, she taught at Ross for 1 year and All Saints University for several years. Dr. Nesty is a wife, a mother of three energetic and handsome boys, and I will attest to that. Dr. Nesty has been quite instrumental in the successful control and management of our current COVID 19 pandemic. For 6 months, she acted in the management role as the director of primary healthcare. She served as a member of the Border Task Force Committee and the Technical Committee, integral in the decision making and the management of the pandemic. As acting director of primary healthcare, she also managed 7 health districts while attaining her certificate from PAHO in public health leadership in December of 2020. She received an International Women's Day Recognition Award on March 8th, 2021 from the Ministry of Youth Development and Empowerment, Youth at Risk, Gender Affairs, Seniors, Security, and Dominicans with Disability. So, Dr. Nesty, thank you for being here again. It is
Thank you.
wonderful having you on the program. And as we can see, we have quite an audience who has joined us. We have Glenda, Mary, Shari, Agnes. So, we want to welcome everyone who is joining us today. So, just kind of tell us a little bit more about you.
Well, I think to be honest, Simone, you've kind of hit it on the head. I am your friend, first and foremost, Gilda, as you've known me all our lives. And, as we've matured and gotten older, we've become wives, we've become mothers, we've become professionals. Um, just like you indicated earlier, well, I graduated with my bachelor's and my master's, and also with my medical school degree. And I work in primary healthcare, and I love it. I love clinical work. I am a clinician. That is my passion, clinical work. And at one point, I was basically taken from clinical work and thrust into a management position, and that is where it all began. So
Hmm.
my introduction from you was quite detailed. I think it encompassed everything. There's very little more that I believe is necessary to share.
Mhm.
So if you don't mind, we can actually just delve right into the meat of the matter.
Absolutely. Yes, absolutely. Thank you for that. And
You're
we're
welcome.
especially looking forward to hearing about your experience with the COVID-19 pandemic. But before we go there, just kind of tell us about your experiences in general, some obstacles you may have faced along the way in terms of your education, beginning your career. So kind of just walk us through a little bit more about your background. And then, of course, we would like to talk about the very instrumental work that you did with regards to COVID-19 in Dominica.
Well, I think right now I've actually reached a stage in my life where I'm comfortable talking about what I considered my greatest challenge or obstacle, like you say, with my academic career. And at the time, I guess I did not understand it. I didn't really know it, but I did suffer from. Uh, there's so many stigmas attached, but I'm actually not afraid to say that I did suffer from from anxiety disorder. So
Ah,
that was a major challenge for me. And the thing is, it was only literally only diagnosed while I practiced medicine. And but I suppose you know that, Simone, because
mm-hmm,
I was one that could never have fingernails. That was just like one of the greatest signs. I was
mm-hmm,
always munching at my nails. Everything was always had me, on the edge, so to speak. So I had my own internal battle dealing with,
mm-hmm, mm-hmm,
especially when it came to taking exams.
mm-hmm,
So that was one of my biggest challenges. And I got through it with college and with my master's degree and with the medical school. And I thank God for that.
mm-hmm,
But it really was quite a challenge. It did a number on me until I realized exactly what it was, and I
mm-hmm,
realized how powerful the human mind is. And if you're not too careful, the ultimate effects you can even have on yourself.
mm-hmm,
So and it still continues. I wouldn't say it is a disorder to the point where I'm non-functional. I'm very functional,
mm-hmm,
but I have learned over the years how to manage a lot of my anxieties, and I'm still not even perfect at it. It is a daily lesson.
mm-hmm,
Simple things, the simplest of things. Actually, I have to sometimes talk myself out of.
mm-hmm,
The simplest thoughts I have to control. When I'm in a group that I am not comfortable with, I have to do a lot of behavioral techniques to actually exist in that group and contribute. A lot of breathing techniques, a lot of self, speaking to myself. Obviously, that's my internal thoughts, and it's been a challenge. And at one point, medication was even considered as a possibility. But luckily, I have been able to do it with behavioral modification.
mm-hmm,
And when I look back at all of the years of my education and have been in childhood groups, etc., I realized that it did have an effect then, and it has allowed me to appreciate the fragility of our mental health, and it has added to my passion and my love of mental health.
mm-hmm,
Because I remember once being told by a very, very good friend of mine who's a psychiatrist that if we don't take care of them, who will? And that is so true.
mm-hmm,
And the number of young females, probably even young males, that probably battle with what I was battling with without any true guidance. Um, I hope and I wish that ultimately one day I can share my experiences with them and probably help somebody else. So I will always say that has been my greatest challenge. It is so
mm-hmm.
funny, Simone, because obviously you know Dale, my brother,
Yes.
and Dale would say to me, I think you have a problem, you have a problem. You need to find out what that is. And that was a long time ago before I even identified it myself. So it's so
Mm-hmm,
funny that, like, he could have zoned into that. But it's just something that you just have. It's just part of me. It's something that I embrace and something that I learn to deal with. And every day I try to deal with it a little bit better. Some days I'm good at it, some days I'm not. And of course, it played a role in my managerial role as the acting director of primary healthcare. But luckily, I was able to handle it, Simone. It was
Yes,
not the
yes.
easiest thing.
Thank you so much for sharing that with us
You're
because I
welcome.
think, unfortunately, in the Caribbean, mental health, there's
Mm-hmm.
still a lot of stigma
Mm-hmm.
and misinformation surrounding mental health. And
Correct.
mine may not have been as severe of yours, but I too suffer with anxiety to
Well,
the
there you
point
go.
where, yes, to the point
Mhm.
where, and it's gotten a lot better now because, like you said, managing it with behavioral
Techniques.
therapies
Techniques.
and techniques. So for me,
Hmm.
working out, eating
Right.
healthy, getting
Exactly.
rest works a lot. And
Exactly.
I want us to have that conversation,
We
Doc.
should.
We need to have this conversation. So I'm
Mm-hmm.
happy that you're being so candid with us because
Mm-hmm.
unfortunately there's a lot of stigma that
Hmm.
still surrounds mental health. And I'm happy that we have Wilhelmina Adrian on the live. You will know her well.
That's my auntie.
That's
Hi,
your
auntie.
auntie. Hey, Auntie Will. And she says mental health is something that is still taboo,
Mm-hmm.
especially in Dominica. But the more we speak about it, the more comfortable talking about it becomes. Happy to know you feel comfortable speaking about it.
Almost
So,
definitely.
this is a
Most definitely.
conversation that we need to have separate from this. So, I'm
Mm-hmm.
very happy that you brought it up. And one of the things that helped me a lot is to sing that song. And today I still sing that song, One Day at a Time, Sweet Jesus.
Mm-hmm.
I
Mm-hmm.
sing that song all the time because it actually helps you to calm down
That's correct. That
and
is
the
correct.
racing thoughts
Mm-hmm. So
of
what
not
I would
knowing what
do
comes next.
what I would do is just like literally call on his name. I would just
Yes.
recite Jesus, Jesus, and tell myself there is power in his name. So it's pretty much you see, we're so rooted in religion in the
Hmm.
Caribbean. So I
Hmm.
think at our age, we have recognized the strength of it and
Yes.
the importance of it.
Hmm.
So yes, it has helped me as well to call on his name, just as it has helped you to sing a song with his name. And
Yes.
ultimately, maybe this is it is also a form of therapy. So,
Yes.
yeah, and to be very honest, Simon, in as a clinician, I was able to recognize a number of females. It is very, very common, in the Caribbean, mental health
Hmm.
issues. A number of females battle with this,
Hmm.
and they don't know who to talk to. They themselves have stigmatized the psychiatrists on the island, so they are not that open with them. And you'd be amazing when you just sit and talk with someone who feels, they have nothing to lose. They don't. You're not a stranger per se, but you're non-judgmental, and
Hmm.
they can literally open up and let you know what they're going through, and you will help. And so that is what ultimately I would like to do for persons. I know this is another show, and it
Yes.
is truly another
Yes.
show
But this is
because
important, so I want you to talk about it. This is important, so let's talk
yes,
about it for a
because
minute.
correct, because the thing about it is, and I have the strangest thing is I've found this ever so prevalent in young females, beautiful young females
Interesting.
with a lot of potential. You understand? Who have confidence issues, who have who are battling with different challenges, and they all just want someone that can understand them and direct them or redirect them to where they can truly find help. And I've had a lot of females come back to me, a lot of young females, even young men, come back and thank me, married women, um, because anxieties can also stress your marriage if you're
Yes.
if you're
Yes.
not careful, because
Mm-hmm.
things that you as a married woman would worry
Mm-hmm.
about,
Mm-hmm.
some other woman may find no problem with it. You
Mm-hmm.
understand?
Mm-hmm.
And to me, men are very simple. They actually
Yeah.
very simple. Okay, you know what I
I
mean.
try not to use that word, Gilda, but it's true.
They're not as complex. Try not to
Mm-hmm.
make them too complex. We understand them. This is what it is. Okay,
Mm-hmm.
but the nagging and the constant bickering and the fighting, it is not something that they embrace truly.
Mm-hmm.
A good man, it is not something that a good man embraces. um but it is something that a woman who is battling with anxiety can find herself doing on a regular basis for no reason whatsoever.
Now
So
let me
go
ask you
ahead.
this, Doc, because this is a very important conversation. So we have to talk about COVID at some point, but let's have this conversation for a little bit. Now,
Sure.
did you find, because this was also my experience, and like you, I've been doing a lot better because I figured
Mhm.
out ways to handle it. But did you find that it makes you very irritable? Because here
Very.
you are, you have a
Hmm.
million thoughts going on in your mind because you don't know what's gonna come next. You're very anxious, and
Hmm.
everybody needs you. Your family needs
Exactly.
you, your husband
Hmm.
needs you, your kids need you, so they're trying to talk to you, and now you have a headache because you have racing thoughts and you have people
Hmm.
speaking in your ears. So did it
Hmm.
make you
So,
an
so
irritable
this,
person
Simone,
like it did to me?
this is so it's refreshing to have this conversation with you because exactly what you're speaking of is what I have been through. Okay.
Hmm.
So what I had no choice but to do was include him in it and
Hmm.
explain to him what goes on with you.
Yes.
You understand? And that is the only
Yes.
way. I think it did a lot in terms of him
Yes.
understanding me and who I am
Hmm.
and accepting me for whom I am or for who I
Yeah.
am. And it has seriously helped. And thank God that I have a husband who is not like, he's not going to go head on with me. You
Hmm.
understand? He knows when to back off
To pull
because
back.
if as a woman with anxiety, you don't honestly pick your partner wisely, you
Hmm.
can have a very tumultuous relationship. You
Hmm.
understand? Very, I hope I use the correct word, but
Yes.
it could be seriously challenging.
Hmm.
So when you get married, you don't honestly sit down and say, I'm gonna choose him because he fits all of these criteria. But you have to understand yourself. And I think that
Hmm.
helped me as a mature bride. I
Right.
understood me and I loved him very much. Don't get me wrong. And I
Hmm.
understood him and I knew he was like the perfect fit. No, he's blushing somewhere in this house, but I'm not making up any stories here. This is
Right. Right.
all truth.
But Doc,
So,
let me say this to you, because 30 years of friendship, and this is the first time we're having this conversation. So I'm so
mhm,
happy that we're having this conversation.
yeah,
And it is so true what you said, because I did the same thing too with Paul. So
imagine
it
that.
got to the point where I was getting the sense that he thought I was a bad person. And I'm all about, saving my marriage. So I had that conversation with him that I
Mhm,
suffer from anxiety, and what we've decided. And the good thing about it is, as you practice this technique, sometimes you learn to cope a little bit better. So
mhm,
sometimes you end up using your therapies a little bit less. So it
mhm,
would get to the point, like I mentioned, having the headaches, where I
mhm.
would have to say to him, I just need a timeout.
Yeah,
I
I
need to go in a
understand.
dark room
I
and take a
understand,
time off.
Simone. I understand
Yeah.
there's several conversations going on in your head, and a lot of the
Hmm.
conversations you're having with yourself, am
Yes.
I? It's all about you. Do I?
Hmm.
All these crazy
Am
questions
I
you ask
enough? Am
yourself.
I good enough?
Oh
What's
my
going to
God.
happen next? Am I a good enough mother?
I heard you say on
Wife?
your show the last time with your guest, Miss Dupini, that you had a problem with your voice. I
Yes.
never knew,
Yes.
Simone.
I never liked my voice. Now look what
Oh
I
my
do.
God, imagine that. You understand? So,
Hmm.
and I never knew that. You
Hmm.
understand? And that is just, I mean, I've never thought to myself, oh my God, Simone has the worst voice ever or a really weird voice. See, I've never, and this is something you are thinking in your mind that there's something
Yes.
wrong with your voice.
So
So
we have so. Mhm.
for me, it was my height. It was my,
Yes.
oh my God,
So
Simone,
many
it was so many.
insecurities.
And I think that's why I probably was just so close to Gina too. Because Gina is just so non-judgmental, just so
Yes.
relaxed and
And if anybody's wondering, we're speaking of our next BFF, Gina Leta, daughter of Norman Leta, and we can't forget Dr. Tabitha Andre that rungs us up
Andre.
to four.
That's right. And it's always been Tabitha. I told Tabitha once, you always just know the correct thing to say, the right things to say. And I
Hmm.
admire that about you. And she was shocked, but it's so true. Like,
Yeah.
she tries not to be confrontational.
Hmm.
So, but I think they're blessed because they don't have to go through what goes on in my mind or
Hmm.
yours now that I'm
Hmm.
knowing about it because it takes away from you. It kind of
Yes.
makes you not even want to be in a crowd to have to deal with
Yes.
it. You prefer
Hmm.
kind of just be on your own and deal
Hmm.
with it on your own by yourself. And that is so not healthy. That is
No,
that
it's
is where the
not.
problem lies. So I'm
Hmm.
proud of you for doing what you do, Simone,
Thank you.
because
Thank you.
Yeah, because and I'm really happy we had this conversation. Oh my God, we used 24 minutes of your time.
That's okay. We have all night. This is our stress-free zone. We come and we chill out and relax and enjoy good conversation. So if anyone is just joining us, we're speaking to Dr. Gilda Nesty-Tonge out of Dominica, and we're just kind of exploring our friendship for the last 30 years, that the things
I
that
know.
we share in common, which
Mm-hmm.
is really battling anxiety for many, many years. And
Correct.
I'm so happy we're having this conversation. And
Hmm.
I'm hoping that we will have a program where we
Yes.
can talk some more about anxiety, especially as it relates, as
Hmm.
Dr. Nesty was mentioning, relates to young women
Hmm.
in Dominica who have
Correct.
severe anxiety. And I'm so happy that they have you, Doc, that they're able to open up with you,
Hmm.
that they feel comfortable to open
Hmm.
up to you, even if they don't feel comfortable opening up to the psychiatrist. It's important to have someone
They can
that they
speak
can
with.
speak with on the topic.
Correct. Correct.
Yes,
So
yes. So I'm looking forward to having that conversation
we
with
need
you
to. We
on
need to.
another
We might just
program.
save someone, out there. So
Yes,
because it's a very it's one of those conversations that need to be had because it's
yes.
so oftentimes just kind of like compartmentalized or
Hmm.
swept under the carpet, but it needs to be dealt with. So
Yes,
yeah, we
yes.
can do that,
Absolutely.
Simon. That would be nice. We
Yes,
should.
I'm looking forward to having this conversation. So now let's talk about
Mhm.
COVID-19 in Dominica. So
Mhm.
let's just start from where we are right now. What is the current situation with COVID-19 in Dominica?
Okay, well, right now, as of the last dashboard, that's March 29th, we have had a total of, let me just speak of the active cases, because if I speak of the total number of cases we have first, then oftentimes I get persons saying, oh my God, but at present, we only have 7 active cases on the island, which is a great thing.
Yes.
So yeah, so we've done a very good job at containment and management. So we have only 7 active cases admitted right now being managed at the COVID hospital. We have had a total of 164 confirmed cases, however, on our small island, and most of these cases are imported cases, whether legally or through our, what we call the back door,
Back
quote
door.
unquote, illegal entry. Um, we have had 157 recovered so far. And Simon, the battle continues. We have
Hmm.
not dropped our guard. We've continued with the very same protocols that we've established since July 20th, 2020. And it's rigid. It's sometimes even looked upon as a bit draconian, but it has worked for Dominica. And right now, with the number of persons vaccinated on the island, unfortunately, we are unable to lighten our protocol measures.
Yeah, definitely. So thank you for sharing that. So I think we will come back to that in a minute. But I
Sure.
wanted to talk to you about your assignment to the position of acting director of primary healthcare in Dominica. So just tell us how that came about, how you got picked to pretty much head up the operation for the pandemic in Dominica. And as someone who suffers from anxiety, I can only imagine your initial reaction.
Oh my goodness. I was like, what is this? This was, oh, Simon, this came from left field. It came from left field because the actual director of primary healthcare, she herself was reassigned to being the coordinator of border control. And on the 20th of July of last year, was it the 20th or somewhere around there? I was just basically told that Dr. Nesty, the director is not available, and so we need you to act in the position of director of primary healthcare. Of course, the whole idea of an acting assignment is something that requires cabinet review, approval, and approval also by the president, etc. So in the interim, I was called the officer in charge. Now that was supposed to have been from July to September 2nd, and it was prolonged up until February 12th of this year. So what was supposed to have been just a couple of weeks, holding on, ended up being 6 months, about 6 months in the
Yes.
position.
So what was the scope of your responsibility?
Oh my God. One of the scope of my responsibilities to answer your question was far and wide,
Immense.
far and wide, immense. Primary healthcare is such that basically you are expected to do what it takes at the the level of the community so that you can reduce admission rate, reduce death, etc., and reduce the patient population in secondary healthcare, which is the hospital.
Mhm.
But in my role, one of my main responsibilities was that of heading the contact tracing team. Now,
Mm.
in the beginning, I will say that this was my greatest challenge because I went into this with the objective to identify every case, to contain every case, to continue to contribute to the zero death rate, the 0% death rate that we had, and to ensure that never again would our borders be closed or would there be some curfew initiated in Dominica. And that was particularly important to me because in March of 2020, when we had our first case from the United Kingdom, when the cases arrived at case number 18, we locked down the country and the curfews were implemented and all students were asked to basically do homeschooling, online learning. Now, in my capacity as a clinician in primary health care, and also my husband's role, we were not parents that could stay home with our children.
That is true. I didn't think about that. That is
So I
true.
had three boys at home with unsupervised online learning going on. My nanny, she's Haitian, God bless her heart, very good nanny, but you can imagine there is a
The
communication barrier.
limitations, the
So
limitations.
yes, yes, yes. So my eldest took basically a semester off. That is the way I look at it. A very expensive semester off because you still had to pay the very
The
expensive tuition.
tuition. Yes.
My middle son, I mean, he did a comeback. I knew my son was capable, but any child that you leave at home, he is a device maniac. He is a computer. He's
Yeah.
just into computers. So
Yeah.
you leave him at home to do online learning with what he loves, and it is very easy for any child like him to be distracted. And this is what
Yeah.
happened.
Absolutely.
My middle son had to oftentimes log on my last child as well as do his lessons. I remember being deployed into various communities throughout the island and having to find reception to call. And while I'm
Wow.
calling, looking on my phone and saying, okay, well, you have Spanish at 11, you have French at this time. Make sure your
Hmm.
youngest brother is on his phonics class, and then
Hmm.
sometimes not even having any reception and
Hmm.
wondering what is going on in my home.
Yes, I can imagine.
It was that. So this was one of my main driving factors when I got into
Mhm.
that role to succeed,
Yes.
because I did not want my children or any other child. No, I'm speaking of my children, but there were a number of other children throughout the island that did not have they did not have the privileges of having a laptop or, let's say, a tablet to do online
Hmm.
learning. So just were basically not in school. They were
Hmm.
just not enrolled. School is very, very critical on this island. It's
Hmm.
critical for a number of reasons. We know our kids are safe, number one. Number
Hmm.
two, they're learning. You understand? They're not home where they're distracted and possibly even engaging in activities that we would prefer to protect them from.
Hmm.
So I will always say that this was one of my major, major propelling factors to ensure that the kids remained in
Went
school
back to
and
school.
that I would succeed at controlling this pandemic to the best way I could, because when it's not only the adults that suffer, the children
Hmm.
suffer even more. And
Hmm.
I don't know what it's like for your daughter with quarantine, but the
Hmm.
short period that they were quarantined at home away from their friends, it was like torture for them. And
Yes, it was.
we have yard, we have
Yes.
enough room for the kids to run
Hmm.
outside. We even
Hmm.
went as far as buying a huge pool I think I
Hmm.
showed you some pictures.
Yes,
How
we saw the
funny.
pictures. Yes.
Right. We tried
Hmm.
everything, but it's just not the same. The
It's
kids
not.
want to be among their peers. They want to
Hmm.
be in an environment of learning where they can discuss with their friends. And, they just want normalcy. So we had to
Hmm.
do what we could, and I ensured I did everything I could to ensure
Hmm.
that normalcy remained. So, so yes.
So you would travel to the various districts, and what were you doing? Disseminating information about the protocols? Is that what
No,
your
no, no.
travels
No,
entailed?
the communication techniques that we used
Hmm.
were not disseminated that particular way. We would use the various media, the radio stations, etc., Facebook, etc.
Hmm.
You know, social media, etc., to actually ensure that the protocols and what is needed and press briefings,
Hmm.
press briefings and um, mostly press briefings to let the nation know of the
No.
protocol, what is expected
Right.
of them. So whistle stops and going from community to community, we wouldn't necessarily engage in that. What we would
Hmm.
do is give short teachings at the health centers.
Hmm.
The patients would come to the health centers because we still allowed the health centers to continue operation, except
Hmm.
that we implemented this, the scheduling, because primary health care is supposed to be free and free healthcare for all. You're supposed to just
Right.
walk in and get primary healthcare, but we had no choice but to implement, appointments, the appointment
Hmm.
system, and
Hmm.
only a certain number of patients at a time so that we could maintain the social distancing, etc., and
Hmm.
promote the guidelines of the Ministry of Health. So,
Hmm. And
so,
that
so,
worked
so
well.
in the beginning, Simon, before I was assigned to the role of director, I was being deployed all over the island. So I was on the ground. I was a foot soldier. The actual technical minds at the back that would generate the list of individuals we would have to go out and target and test, etc. That was not me. All I had to do was wait to hear where I'm being deployed to, who are the persons that I need to test, okay? Get on that bus, and we would navigate the island in a non-air conditioned bus, hot sun, looking for all who has been in contact with whoever the contact was,
Hmm.
and do our job. So that
Hmm.
was that. Then, after being assigned to the position of director, then I became now the head of that contact tracing team.
Hmm.
So, and funny enough, that contact tracing team, the technical minds behind it was just a total of four individuals. Myself,
Wow.
yes, myself, a senior community health nurse, Nurse Liz, Dr. John, she's the chief dental officer, and Mr. Lester Guy, he's the coordinator of the HIV unit. And with
Hmm.
every case, because we came in at case number 18, and I believe I left off when I was allowed to go on leave after being very, very, spent, tired. I
Hmm.
left off at case number 136 or 140, and I came in at case number 18, basically. So
Wow.
that's quite a few cases that
Hmm.
we had to ensure were always contained in the COVID isolation unit for proper
Hmm.
management. Now, not every one of these cases in between required extensive contact tracing. Some of them, because of the guidelines and the protocols that we established with the technical committee and the border control task force, they were quarantined from the time they got on the island. And
Hmm.
once, we did our what we call a 5-day PCR, we were able to identify them.
Hmm.
So they were able to be contained at the COVID isolation unit. But those cases in the communities from the back door, those cases that at one point or another, maybe they got out into the community. I mean, errors do happen. We had
Hmm.
to contact trace.
No, I have to tell you, Doc, we have a very active audience viewing this program on Facebook Live, and we absolutely appreciate them for being here, and we encourage them to share the live and share this information that we are presenting today. But one particular question jumped out at me, and of course, if I'm missing your question, I am completely engaged with Dr. Nesty right now, so do forgive me. I'll try to catch as many of the questions as possible. But Dave Bertrand asked, what measures are in place to prevent people from walking out of the quarantine centers?
Okay, so that's a very good question.
Yes,
And
I think so too.
yes, and I'm going to try to do my best to answer this question. With
Hmm.
every quarantine facility, Simone, that is granted the license to be a safe in nature property or a quarantine facility, they have to agree upon having on site security. Ensure
Mm.
that persons who are at the safe in nature property, we call it safe in nature properties or quarantine facilities, it's the same thing, do not leave the compound. Now, it's a certain level of trust that you give to a property. Um, it's a
That's okay. I've had that happen too, where the little one pokes their head into the camera.
it's a certain level of trust that you give to the property, and you kind of like hold your breath and wish that they actually implement. And there are penalties if you don't. You can lose your certification,
Hmm.
etc. And right now with our weakened tourism industry, the importance of allowing different hotels to be certified as safe in nature properties allows for these hoteliers to continue have some, to make some money.
Hmm.
So to lose your certification is a very big deal for a hotelier or proprietor who has a safe in nature property. So it is expected that they have security measures in place. Now that was in the very beginning, and obviously that didn't work. A number of persons would still leave the property and venture outwards. And we would get reports of this person was supposed to be in quarantine and they're seen at X, Y, and Z. I have had my share of having to send the police or and it's not a nice thing to send the police
Yeah.
who is supposed to be in quarantine, but they're not in quarantine. I have been I've been called names for doing that, but I have no choice because on our island, persons are very carefree and very innocent. Okay, I don't know if it's because we've had a zero death rate, but we cannot quite get the Dominican population or the gross majority to respect the protocols. There's penalties in place, there's charges in place, there's all of these things in place, and we still have persons dropping their guards significantly. We have we have moved on from from just relying on the security of the proprietors to the presence of wristbands, and also not just the wristbands that would say safe in nature, the plastic ones, electronic wristbands, so that you would be somewhat in a um, electronic gated
Hmm.
environment, so to speak. They're electronic wristbands. So all of that has now been implemented, and the success of that we are seeing, but we are still not 100% able to say that when someone is in quarantine, we can guarantee you that if it's in a safe in nature property, they respect the quarantine measures. But we are doing everything we can at the level of the Ministry of Health, at the level of the police department, etc., to try to do so. But we get most of our problems from nationals returning to Dominica. So
Interesting.
yes,
Hmm.
it's very interesting because once they arrive on island, it's the strangest thing. I guess I can understand they're home and they want
Yes, and they want to go home.
and they want their freedom. And persons that probably had accents for days in countries that they reside in come to Dominica, and all of a sudden they pull out the Creole and they're starting to.
When they're ready to go see how they pick Creole, right?
Oh my goodness! And they want to leave, and we've had many battles, but
Yes,
good
yes.
that answers your question. So
Yes, it does. It